President Biden received his second dose of the COVID-19 booster this afternoon.
Mr. Biden rolled up his sleeves in an effort to encourage and educate Americans about the updated shot. This comes as the White House is struggling to get the new shots on the arms of Americans across the country. Federal health officials are warning of a possible uptick in COVID cases heading into the winter months. And the president says getting boosted is safe and effective and a good way of preventing further coronavirus-related deaths in the months ahead.
As we enter this new moment in the battle against COVID, let's use it to start fresh as a country, to put all the old battles over COVID behind us, to put all the partisan politics aside. We've already lost over 1 million Americans to COVID, over 1 million Americans to COVID. You know, we can do so much now to reduce the number of people who die from this terrible disease. We have the tools, we have the vaccines, we have the treatments. None of this is about politics. It's about your health and the health of your loved ones.
We want to bring in our own guest now, John Moore, joining us. He is a professor of microbiology and immunology at Weill Cornell Medical College. It's good to have you with us. So the president had COVID back in July. Is that part of what took him so long to get this second booster?
Yes, I think so. The CDC recommends a minimum of 2 months after a bout of COVID or a previous vaccination before you have a booster dose. I think most immunologists think that 2 months is actually a bit short, and it should be closer to 4 to 6 months. So I think the timing reflects when he had Omicron infection.
You know, one of the things that really worries people, and I recently interviewed somebody who is struggling with long COVID. This is something that's truly concerning, just the long list, eternal list of symptoms that some people are struggling with and who feel kind of, invisible because doctors don't know how to treat it and don't know how long this could last for them. Can those people get the booster? Is that recommended?
Under medical advice, I would always consult the physician who is responsible for the primary care or the specialist, long COVID specialist that a patient might be seeing. But broadly speaking, the answer would be yes, and it may be beneficial. But I do think you should consult the physician before doing that because you have a medically sensitive condition.
And does the booster help people in not getting long COVID, or is the science still unclear on that?
Well, preventing infections will prevent long COVID. So the goal is to reduce the number of people who are being infected, and that will have a kick-on effect of reducing long COVID symptoms. It's not clear how well these new boosters are going to be able to do that. They're somewhat being talked up in the capacity to prevent infections. I think there are a lot of people who are going to get boosted and are still going to get infected. And there's an important message in that. You should not believe that these boosters give you super strong magical powers that will make you resist any virus exposures. And if you do believe that and you change your behavior and you behave recklessly or carelessly and increase your exposure, that can be counterproductive. So you still, even after boosting, need to respect your environment, need to respect the viruses to which you might be exposed. So you can't rely just on these new boosters alone.
That's a good point. The CDC and the science surrounding the vaccine has been the subject of a great deal of misinformation throughout the pandemic. And right now, there's new misinformation campaigns that we've seen cropping up. So what role do you think that this is playing in these lower than expected updated booster numbers?
Well, when the president said this is not a political issue, it is, of course, a political issue. And the people who are at greatest risk of dying of COVID are the people who've rejected vaccines. And so getting a booster is irrelevant if you haven't had your first doses. So why have they done this? It's because they don't go to CBS for their information. They go to Fox News. They listen to Alex Jones. They read QAnon. They get bad information from talking heads. I mean, people like Tucker Carlson and Alex Jones, the words that they utter affect people's decisions and leads them to make terrible choices and effectively kills them. So, there's a great deal of responsibility on the purveyors of bad information for the death toll in America, which has been concentrated increasingly in Republican voters who get their news and information from false sources.
And specifically, Professor, there's one point that I hope that you do have this information, because you're mentioning something, and I have seen this misinformation going around about, people questioning whether the CDC is trying to, or the federal government is trying to push or force children to get vaccinated. That was not the recommendation from the CDC, correct?
Yeah, it's an out-and-out lie. It's a classic Twitter-inspired disinformation pile-on. The CDC is allowing states to include COVID vaccines in the childhood vaccine regimen recommendations. It does not mandate the states, and the states will make their own decisions based on what state officials think is best for their population. And I think it's highly unlikely, because of the politics and because of the social disruption, that the COVID vaccines will be mandated for children. Yeah. So it's a non-story, but it's classic of where we are in America today.
Yeah, people sharing news that they see in a headline, not from a vetted source. Thank you so much, Professor Moore. Appreciate your time and clarity.
You're welcome.
And be sure to watch Primetime with John Dickerson tonight. He'll be speaking with U.S. Surgeon General Dr. Vivek Murthy about mental health in the workforce. That's tonight at 7 p.m. Eastern, right here on CBS News.